All right, so this ground exercise is going to be for anti-extension. It's going to be an anti-extension exercise, and when I say anti-extension, basically I'm looking at thoracic extension. You may or may not know this, but we live in a world where we're overly extended in the rib cage, which it throws off head patterns, pelvic positioning in space, and then it can also lead to, you know, a hyperlordotic curve of the back, or it can even lead to like a kyphotic curve in the back, but then you're living extended up here, and basically it's like overly extended positions often lead to manifestations of pain somewhere in the body. Okay, so I like this next exercise because it's simple, it's easy to do, and if you are an athlete who puts their arms in the air for anything, okay, even a yogi or something, it's nice to check in with your thoracic area and see if you can create a little bit more flexion and a little bit more humbling down of the heart and sternum. So all you're going to do, you lay on your back, reach your arms up, plug your shoulders down, palms face each other. All right, I'm going to lift my legs up, ankles higher than my knees. I want to give myself a double chin, and then first practice pulling your butt and sacrum off the floor. Just see how that feels, and down. Okay, you want the low abdominals to engage, you want the middle abdominals to be a part of this. Again, I'm going to lift. I hold. On an inhale, take the arms to the letter V. Exhale down. Again. Every time I breathe out, I'm pulling my belly button to my spine. After I do X amount of reps there, I'm going to do some dead bugs. So I breathe in, and I breathe out. All right, and every time I breathe, I think about expanding and reaching. And every time I breathe out, I think about, again, bringing the core closer to the spine, closer to the rib cage, and trying to feel my entire back on the ground. And sometimes I'll then just finish with a few side-to-side rocks on my SI joint, or maybe some rock and rolls forwards for my spine, and for the posterior compartment of the area we just focused on in the spinal column. So if you're someone that puts their arms in the air for any sort of physical activity, please make sure you're doing your anti-extension work as well. Thanks.